Using the crutches, both crutches, and using a railing. If you have a choice, always have them use a railing. But it's not always practical. You're going to want to show them both, because if they change a curve, it's the same principle like a curve or anything like that, or they went to someone's house where they didn't have a railing, they should know both. Do you mind using other stairs? Sorry. Okay, so non-weight bearing first. That's the hardest one. Okay? So I'm just going to demonstrate the pattern. Then I'm going to have one of you guys do it, and I'm going to show you how to guard. Okay? So up with the good, down with the bad. So I'm going to put my weight through here, right? I'm going to pop up, and then my crutches follow up. Okay? Up, just like that. Okay? Now, if I was weight bearing as tolerated, I'd obviously keep my foot down, push through my hands, same thing, up. Right? Up. Up. Okay? Pretty simple. Okay? Now, railings. With these crutches, it's kind of easy to put them in both hands, but if someone is uncomfortable, they can always go like this, okay, to do it. If they wanted to, they could put it against here, but it's the same thing. Using the rail, up, up.
Do you use the unaffected side for the railing always, or does it not matter really?
No, it doesn't, because basically what you want to do is you want to ask, I always ask patients what their home situation is. So I don't really want to teach someone to use the railing on one side if it isn't applicable to home. I always want to try to simulate a home environment. Otherwise, like if they're going to be using public stairs, most people go down on the right, up on the right, yep. So I would teach them that way, so that they're used to it, so it's like normal flow. Okay? So now coming down, which is always the scariest for people. Non-weight bearing, you want to have their foot out in front, because if their foot's back here and they're trying to hop down, it can kind of catch you and you can go tumbling forwards, okay? So legs gonna come out, assistive device, good leg.
It looks scary.
It's scary for people. This is what the people will be the most scared here because of that, okay? So like that. And then if they have weight bearing status, they can be weight bearing tolerated, partial, whatever. Crutches, bad leg, good leg. So down, up with the good, down with the bad. Okay?
Oh, it makes sense to go together. Yes, you're still good, it's still up.
Yep. And then if you had to use one crutch, whatever you wanted to do, crutch, bad leg, good leg. Good? Alright, who wants to be my guide? So whenever you're going down the stairs, you always want to lead with your assistive device, and then partial weight, still maintaining your same weight bearing precautions. Nothing changes with that. You're going to bring your bad leg down, followed by your good leg. Any questions?
No.
Okay. So I'm going to have him go this way. There you go. Good. And I'm going to go here. So you can put your foot down. Remember? Your partial weight bearing. So put your weight down for balance. Good. Good. How you feeling?
Good.
Any lightheadedness? How's your pain?
I'm hanging.
Okay. You're doing great. Good. Excellent. Nice job. So now when you go up the stairs, you want to lead with your good leg. Okay? Still maintaining your same weight bearing precautions.
This side.
You can stay this way because we're going to go close to the wall. This is our option. Yep. Good. Nope.
Whoops.
Okay, what did you do wrong?
Went up with
Right. If their crutches are up here, there's no way they're going to get any leverage. So, up with the good. Good. Excellent. We're downstairs, one for upstairs. So much easier. And then you would want to instruct them probably with a cane and the railing because it's just safer. But that's not always ideal, so sometimes you have to instruct with this. The book was a little bit, they said to have the, I think facing this way, unless for space issues. So if you had a really, which I agree with, if you had a really crowded walkway, would you necessarily want these facing out if you were trying to come up? No. I would put them this way, so that A, they're kind of like in the protection of the walker, there's less things that they could trip on. So it just kind of is common sense, right? So then the walker stays here, okay? So it's the same thing. Up with the good, down with the bad. So if my left leg is my bad leg, I'm going to go down, right? I'm going to move the walker. Always when you have an angle like this, you want it back. You're putting weight through, you're lowering down. Okay? Walker. So it's going to be, you're going to have it up with the good, down with the bad, right? So I'm going to go up with my good. And the walker's always one step ahead, okay? Because you want to push through stability, just like that. The other thing that you could do is, this one isn't full, but you could fold it and kind of use it so that there's less. So you can use a cane with a railing, without a railing. If I was testing someone on the stairs for the first time and the railing was an option, obviously I would want to do that. Even if at home they maybe didn't have a railing, just so that they get used to it, I would probably instruct them with a railing first so they get the sequencing down in a more safe environment, and then go to walking with just the cane. So I'm going to assume that my left foot, again, is my evolved side, so it's going to be the same exact thing. Up with the good, down with the back. So railing, you're going to push through here. The cane is where people are going to want to come up here, because it feels a little bit funny, but you want to push down, and it comes up with your evolved side, okay? So you're pushing, coming up. Up with my good, just like that. Pushing through my cane, okay? If I didn't have a railing, it would be the same exact thing. Up with the good, pushing through, okay? Guys good? Mm-hmm. Cane is going to follow, right? Cane, bad leg, just like that. If I didn't have a rail, it would be the same exact thing. Cane, bad leg, that. When I'm teaching someone to walk with a cane, it's going to be in my right hand, because they're going to go together, right? Same thing, if I was not using a rail on the stairs, they didn't have a railing, it would still stay in the same hand. Same exact thing. But you're going to have to switch hands depending upon if there's a railing. You're going to have to adjust. You know that when you're walking with a quad cane, you want the flatter side to be the side that's closest to the body. So they don't trip. That makes sense, right? It's kind of like, it's just all common sense. Okay? So, it doesn't really matter when you're doing the stairs, but it's going to be the same thing. It's going to be sideways like this. So here, if my left, again, is my involved side, I'm going to go what?
Up with the good.
Exactly. Just like that. Okay? Because it won't fit otherwise. It's too rickety. Okay? Down the same way. Up with the good, down with the bad. So I'll left to my involved side. Bring this down first, right?